Well, hi, this is Tracy with ADHD Life Medical Associates, and I have Lauren Hendrickson with me, an audiologist. Um, got her audiology degree, doctorate from Purdue University, and has been practicing since 2007. And you've had your own private practice since 2011 in Carmel, Indiana. It's the Northside Hearing Care. Thank you for being with us. I really appreciate it.
I am happy to be here.
I'm excited to talk about auditory processing disorder
Mhm.
because I don't think many people know about this. And I think it's something very important the community know more about and how to screen for it and when to get help. But first of all, let's start how you even got into this field.
So I got into, I've been an audiologist for a long time, but I got into auditory processing because of my own daughter. I have a 12-year-old. That way I have three daughters, but my 12-year-old is the one that prompted all of this. She was diagnosed with ADHD back in first grade. And, uh, we tried the medication and things just weren't improving. And I kept feeling like I was being gaslit by teachers. Oh, she's not a strong reader. She needs to try harder. Try a different medication. She just, she's just not a strong student. And I was like, this isn't making sense to me. It's not adding up. And I started looking into things on my own. And I came across and I was like, oh my gosh, why didn't I think of auditory processing before? And I feel like a horrible mother knowing that I'm in the field and didn't know this. So I took a course and learned all about auditory processing because in grad school they teach us one small little class. I think we spend maybe two class sessions on auditory processing. It's such a small little blip because it's just not the main focus. So I took an entire intensive course, and Bridget, my daughter, was my first patient I tested. And then I felt horrible because she has a very, very significant auditory processing disorder. Started working with her, and it's been amazing the difference that it's made, and how we communicate with her, how she understands, how she hears and understands. And it's been life changing. And I'm like, oh my gosh, if I can do this for my own child, what can I do for other people? And so that's where my side business, with the auditory processing disorder, it kind of come into my practice, and it's become my new passion. It's given me the excitement to be an audiologist again because I have been able to really help people and change some lives for these kids. And it's been amazing to see them come out of their shells.
Awesome, awesome. And so what I hear you telling me is this is a niche. This is very specialized and not all audiologists um, screen for this or know kind of how to treat it.
That's correct. I believe in the state of Indiana right now, I believe there are four audiologists that actually test and treat auditory processing disorder.
Wow. Awesome. I'm really glad that you're here to
Yeah.
kind of help us learn more about it because I know, I have a master's in nursing and I'm a nurse practitioner, but we just touch on these things. Like you said, it's just, in school, you're given so much information, some things you just can't get really detailed in. And so areas like these, it's awesome to have specialists like you be able to kind of teach us, what to do in the medical field and how to find you. So, auditory processing disorder, like when I think of audiologists and with you, testing for this, I think of just hearing. But can you tell me what exactly APD is? And I mean, is it a hearing disorder?
So it's not a hearing disorder. So auditory processing is what the brain does with what the ear hears. So typically, people with auditory processing disorder have normal hearing. And by normal hearing, I mean you listen for the beeps, you raise your hand, you push a button. All of that is within normal limits. And in quiet situations, most of these people can correctly repeat back a long list of words at a very high percentage of being correct. So on paper, they're normal. And that's why they're saying, well, your hearing's normal. It's not your hearing. Your hearing's normal. But that's not what's really going on. So the higher processing of, okay, we hear sound come into our ears, then our brain has to interpret what those sounds are and then attach meaning to them. That's where the auditory processing disorder comes in.
Wow. Okay. All right. That definitely makes more sense.
Mhm.
What causes this?
There's all kinds of things that can lead to it. For kids, the number one issue that we see is kids who have chronic ear infections are at a higher risk of having an auditory processing disorder, and that's how it was with our case. When you have chronic ear infections, you've got a bunch of gunk or fluid in the middle ear space, and it's impacting how clearly you hear. So when you're not hearing clearly, you're not correctly learning what sounds sound like and what words really sound like. So that's going to impact your reading abilities. That's going to impact your ability to comprehend what somebody is saying to you. And eventually, yes, we clear it up. We get tubes in the ears, we hear normally, but that learning is already done with the brain. So then the brain has to relearn, oh, that's not what that word sounds like. That's not what that means. And so the breakdown's already there.
Hmm,
And so that's
interesting.
with ear infections, that's one of the big things. Um, we see a big correlation between dyslexia and auditory processing disorder. And then in adults, it can also be from chronic middle ear issues, or it could be from like a traumatic brain injury, just a concussion, or viruses. I had a patient who had a very severe virus, almost died, and then now presented with auditory processing disorder. So it can
Wow.
be across any age span.
Okay. Wow. Yeah. And so, do you in your practice, do you see more kids or do you see more adults or is it kind of equal?
It's kind of equal, but I would
Hmm.
say tend to see more kids.
Hmm.
Typically, by if people have had this as children and they grow into adults, they have learned for the most part how to adapt, deal with it. They have their own strategies for working around it. So we see it more with kids who are struggling in school. The parents are trying to find answers to figure out what's really going on. So that's the primary age group that I work with.
Hmm. Do you find that a lot of that schools are pretty good at picking up on these things and referring out to you?
Not at all. Not at all.
Interesting.
I find it's the parents who start
Hmm.
pushing because the school says, oh, nope, their hearing's normal. They don't need the
Hmm.
IEP. They don't need the 504.
Hmm.
It's something else. Let's throw a pill at it. Let's just put them in extra, we'll pull them out for extra instruction. They don't want to get to the root of the problem. And so I
Hmm.
find it's the parents that start digging and start researching and figuring out, okay, here are my kids' symptoms. What does this
Hmm.
mean? And they're the ones that start instigating the the testing.
Well, it's interesting you mentioned root of the problem because I think, and that's in the medical field too, I think it's not always not wanting to, it's just not knowing enough,
Mhm.
asking enough questions or, knowing more about these disorders that and how to screen for them and when to refer out. So, I'm super passionate, obviously, about ADHD and providing more education, but it's like I said, I agree. It's a lot of times in medicine too. It really takes a lot of questions, a lot of time to really get to the root of the problem. So looking at this, what advice would you give, to providers like me and school staff and parents? What are the signs and symptoms? When do we start referring to you? When do we get worried?
So the biggest signs are going to be speech delay in little kids, articulation problems that are not age appropriate. Why do we
Mhm.
have that? Chronic middle ear issues, difficulty learning to read, difficulty reading out loud is a big one. If they respond quickly or if they respond slowly to commands, like they need extra time to think about what has been said. These are all significant red flags for me going, aha, there's something else
Mhm.
going on, and we need to figure out what it is.
Yeah, and I know we work together, and I
Mhm.
use something called Mind Print cognitive assessments, and that helps me screen for APD, among other things, so that I'm making sure I get the diagnosis of ADHD right. You'd also shared with me, is it the Buffalo scale, or what
The
is that?
Buffalo Model
Mhm.
Questionnaire. It's a
Mhm.
series of questions. There's 25, I believe 25 questions that we're going through, and it's all different uh, sections on how well do you hear a noise, and if you have speech delays, middle ear issues. And if you answer yes to 8 or more of those questions, then that is a sign that, hey, further testing is warranted. So it's a great screening tool.
Awesome, awesome. Now, if a teacher or a speech therapist or
Mhm.
someone recognizes this, they do that Buffalo scale and it screens positive for it. Now, can they just refer out to an audiologist like you, or should they
Mhm.
start with their pediatrician or primary
Nope.
care doctor?
I would refer out to somebody that specializes in auditory processing disorder. A traditional audiologist, they're going to be great because they can at least do a hearing test and rule out hearing loss as a contributing factor. But once that's ruled out, we got to get to the root of the problem and find out, is it an auditory processing disorder? And if it is, what categories are we dealing with? Because there's 4 different categories that we're looking at within that auditory processing diagnosis. So you're going to be better off going straight to an auditory processing specialist, because the first
Mhm.
thing that I also do is a hearing test to verify
Awesome.
that, yes, we're hearing normally. I'll do a test to see how well the eardrums are moving to make sure that we don't have any fluid going on right now, and then dive right into everything.
Okay, awesome. Yeah, I think people really appreciate not all those extra steps and being able to go straight to the person who can, you
Yeah.
know, who can help them.
And most pediatricians, honestly, don't know enough about
Mhm.
auditory processing. Some have probably never even heard of it to even know where to refer to.
Okay. All right. And you are in Carmel, Indiana.
In
So,
Carmel. Mhm.
for anybody local, you're definitely a great asset for us. Now, what do you do? What is the diagnosis, like the protocol for that? How do you do that?
So the first thing that we start with is case history. So I will do a case history phone call typically with, if it's a kiddo, with the parents. I
Mhm.
want to do it over the phone before they come in for their appointment for a couple of reasons. One, it takes up to potentially 30 minutes, and kids get bored sitting around. And so it's less time that they have to sit and be entertained. Two, I want the parent to be able to speak freely about their concerns without worrying about the child overhearing or the child becoming sensitive to struggles that they're having. So I want the parent to lay it all out there. What are they worried about? What started this process? What made them kind of move forward with an evaluation? So that takes about 30 minutes. Then I'll have them come in for the evaluation. We do the hearing test, and then the test protocol that I use, we test words in quiet, words in background noise, and then we do a test called the SSW, which is staggered spondaic words. So there's basically 4 words that are said at the same time. 2 of the words are going to overlap, and then the child or the patient has to repeat back in the correct order all of the words that they heard. And then the next test after that is we take words and break them down by phoneme, so sound by sound, and then they have to blend that word back together. So if you heard the sounds sh, e, then you have to be able to say, oh, that's she, and put it back together. And then there's a fun game on an iPad. So I always save that for the end and, kind of dangle that in front of the kids as you get to play an iPad
Yeah.
game here soon. And
Hmm.
it's just a fun game that tests more dichotic listening skills. So how well we hear with both ears together at the same time. And then all of that together gives me all of the data that I need to look at standardized scores to see where these kiddos fall.
Okay. Awesome. Awesome. Now, with ADHD, do you see a lot of overlap with this?
I do.
Mhm.
And I'm starting to wonder, I have no research, maybe this would be something fun for us to do together. I have no research to back this up, but I'm wondering, are kids being misdiagnosed or
Mhm.
overdiagnosed because they really have an auditory processing issue and not ADHD? But there's a lot of similarities. So if you think of a kiddo, and the hyperactivity does not apply to this. That's totally different. But the attention deficit, if you are in a really uh, an environment that's distracting to you, and it's hard to pay attention, and it's a boring, it's you're in class and you're learning a new math concept, but you've got somebody back behind you rattling papers and tapping pens, what are you going to pay attention to? Not the teacher. That's hard. It's hard to focus
Mhm.
on things that are hard to understand when I can listen to the noise behind me. So it looks
Mhm.
like I have a behavior problem. It looks like I'm not trying, I'm not paying attention, but really I'm not understanding what the teacher is saying. And so it's easier to tune out.
Yeah. Yeah. No, absolutely. And with me, with testing for ADHD, I mean, I have to rule out so many different things. And that's why anything I can have in my toolbox to also screen for, that's huge. That's huge because it is just ADHD is it's a diagnosis of exclusion.
Mhm.
So it does make me wonder if, all
Yeah.
these folks that got, diagnosed with inattentive ADHD, they really have APD.
Mhm.
Yeah. So definitely something that I'll carry forward in my practice. And um, again, I use screening tools for this as well to try to make sure I weed this out. And I'm sure you're going to get plenty of more referrals from me in the future. Now, with parents, how can they, or even adults who need to get tested for this, how can they prepare for, testing? Is there anything they need to do?
Nope.
Okay.
Nope. Um, for the kids, I would actually like to see them at their worst. So,
Mhm.
not fresh
Interesting.
in the morning when they're well rested. Come in at the end of the school day when you've been trying to focus all day and pay attention and you're exhausted. I want to see how well you're going to do in those situations because that's going to give me a peek into the real world.
Yeah, yeah. Well, I mean, it is what we see is, these kiddos, they're so, some days they're on, some days they're off, they might be able to hyper focus and do better, but what you're looking for is on a general basis.
Mhm.
What is this kiddo like? So that's interesting. You should say that.
Yeah.
So treatment, my child comes to you and gets diagnosed with this. I mean, is what can we do for it?
So it depends on what we find.
Mhm.
So we're looking at four different categories that we're testing for. So there's decoding, which is just how well are we hearing the signal? Is it clear or not? Tolerance fading memory is looking at short-term memory. So when I have you repeat back three words to me, are you able to repeat back those three words, or are you going to forget one or two of them? Organization is if have you repeat back those three words, can you keep them in the same order that I gave them to you? And then integration is how well the eyes and the ears kind of work together. So are we understanding what we're reading, or are we getting mixed up because our vision is telling us one thing and our ears are telling us another? So based on what we find there is kind of how we guide our therapy options. The most common option that I recommend is auditory training therapy through the Buffalo model, which was all designed
Mhm.
by Jack Katz, The screening, the test protocol, and the therapy were all designed by him. And it's amazing. And his theory was all simple but effective. And it is. So, with this therapy, we go back to the building blocks. We want to get to the underlying root problem of the auditory processing. And we're going to retrain the brain what every sound sounds like. And then we're going to practice this in background noise and in quiet. And then we're going to practice breaking down words and then putting them back together. And the therapy is 12 weeks long for 1 hour a week. Then at the end of that 12 weeks, we pause and we give the brain another 6 months to really finish retraining itself because it's still practicing. At the end of that 6 month period, we can then retest to see, okay, did we make enough progress? Do we need to do another round of therapy, or are we pretty good? A lot of progress is made with just 12 weeks of therapy. It's really amazing. If we need more support, so say a kiddo is in school, or college students are another great example of this, and they need extra support in the classroom, then we might look at low gain amplification. So a hearing aid that gives us just a little extra boost in volume, and then we can have their teachers wear a little microphone that transmits what that picks up directly to their hearing aids. So like a little mini personal FM system. That has been life-changing for a lot of my patients, including my own daughter. I put hearing aids on her and we went out to eat and she goes, I can hear you guys. And I was like, it
Oh,
broke my
that's
heart
awesome.
because I'm like, I didn't know that you couldn't hear us in a restaurant. So low gain hearing aids have been, and that is a more expensive investment, but it 100% can be worth it. Um, then there's some apps, depending on where the struggles are at. There's some apps that we can recommend that they can do at home on their own. Um, and just kind of practicing, just reading aloud. And then with the therapy, just keep working on the skills that they learned in therapy. And those are the biggest ones. And it really is that simple.
Yeah, it sounds like you can just change the trajectory,
Yeah.
of a kid's life very easily. And,
Mhm.
it makes me wonder how many kids are walking around, with this. And
Yeah.
so, I mean, your daughter is very lucky she had you. I mean, that's amazing. I think that, again, you rely on the school or your pediatrician to be able to pick these things up, but I mean, just quite frankly, there's just too many things.
Mhm.
It's just too big, and there's
Mhm.
not everybody has the education on this. So really spreading the word, and I hope that people watch this and they tell other people about this, because I know from my own personal experience, when I've referred, patient to you, and that kiddo was just like, I'm dumb. I've tried everything, tutoring, the school has done things. I got diagnosed with ADHD. I was on medicine. It didn't help. That all these things, and you just see that you see the hopelessness in their eyes, and you see the parents and the desperation, what just another try. They've tried so many things, and to be able to actually point them in the right direction, get them the right diagnosis. I mean, I think that is just awesome.
Mhm.
That's just awesome.
I've even seen a patient of mine who has been diagnosed to be on the autism spectrum, but she now, with her hearing aids that she's been fit with, she can hear intonation patterns. She can pick up on sarcasm, all of these things. And now it
Wow.
makes me wonder, was she misdiagnosed? And I know there's still underlying things,
Mhm.
but where is she really at on the spectrum? That
Wow.
makes me, yeah.
Yeah. Yeah, I didn't even think about that, and just
Mhm.
like the correlation of that too, right? Because there's so much overlap in a lot of these disorders. Working memory, I heard basically
Mhm.
that so much of what you were describing, and that is so huge in ADHD. But working memory deficits are huge in anxiety, and it just so many things, and so on and so on. So, and just like you said, the ability to remember and recall, and be able to repeat things in the right order when you're doing those testing. That is all that's working memory. So, well, and resources. So any, resources that you could offer parents if they are not quite sure, if they call you yet or they want to just find out a little bit more information, what direction would you point them?
Yep, the Auditory Processing Institute that is run by Dr. Angela Alexander would be a great place to start. She has great resources. She trained under Jack Katz, and now she is training other audiologists. So she's actually the one that trained me as well. So she's an amazing place to start. And then she has resources for providers all over the world that work with auditory processing disorder. And so that can be a great place to start to find out who you could go to in your area.
That is awesome. Which kind of brings me back to another question about, treatment. And you talked about kind of what the treatment looks like. And so I'm assuming, so speech therapists are the ones who do
So
this?
audiologists can also do it.
An
I
audiologist? Okay.
typically refer my patients out to a local speech therapist that specializes in it only because she's in network with insurance companies and I am not.
Hmm.
So
Yeah.
it can be more of a cost savings. Um, Insurance does not cover the price of the testing. And so any way I can help save money down the road, I like to do that. And so there's a speech therapist here in Carmel that specializes in auditory processing therapy.
So not all speech therapists would be equipped to handle this, is what you're
Correct.
telling me.
Correct.
So it's another, just like audiologists, they have
Mhm.
to seek out continuing education.
Yes.
Wow. Okay. All right. So it's good to know there's one in Carmel. What is her name?
Oh, I knew you were going to ask that.
That's okay. That's all right.
Now I'm drawing a blank.
That's okay.
Hello.
Set you up for failure on that one.
I know. Let me I'm gonna look it up here real quick because
Yeah, no
that is
problem. No
going
problem.
to,
Well, and while you're looking it up,
yeah.
it's really good to know it sounds like insurance will cover the therapy portion of
Yes,
it.
yes. Tara
So
Jones.
that's huge. Tara Jones
Jones.
in
Yes,
Carmel, speech
yes.
therapist. Okay, awesome. So yeah, it's great that, that insurance will cover that.
Mhm.
So people can be confident that, they can continue to get this treatment that
Mhm.
they need. Do you see a lot of school therapists having continuing education on this? Not really. Okay.
Nope.
Yeah, and again, there is nothing, I am not faulting, this profession or schools. Not at all. It's
Mhm.
in the medical field in general. We were talking about pediatricians, primary care. There's just so much to know.
There is.
And if you don't have the education, and hopefully this inspires people to go out and get the
Mhm.
education that they need to be able to serve their students and their patients as well. But it's just the more you know, the better. And there's
Mhm.
just all these little things that they're really big things if you can get them diagnosed and treated appropriately.
Yes.
So, no, that's awesome. And how do people find you? And how
So
quickly can they get in?
they could get in just typically within 2 to 3 weeks, we could get you in for an evaluation. You can find me through my main website, which is northsidehearingcare.com. APD Solutions is the name of the auditory processing company that is under my parent company. Um, and that's because of insurance
Mhm.
stuff. But northsidehearingcare.com will take you to my main website. My phone number is 317-818-3490, and that will get you to the main office number.
Awesome. Awesome. Is there any final advice or, words of wisdom you can give to parents who are listening
Go
to
with
this?
your
And
Yeah, go with your gut. Listen to your gut. If it doesn't sound like it's making sense or you feel like school's trying to blow you off, go with your gut and don't ever doubt yourself because parents know parents know best.
Yeah, definitely, definitely. We see our kids all the time, compared to these other folks that I just don't think they see, the 24/7 what it looks like. So, well, awesome. I really appreciate you doing this interview with me. Again, I'm Tracy Meyer with ADHD Life Medical Associates, and I'm located in downtown Fishers. And you can always start off with a screening for me if you're like that. You tried the Buffalo scale and it didn't like highlight like crazy. You can always come to me and I can screen you further and then refer out to you if appropriate. And I know I plan on continuing to, work as a team and, I'm always trying to improve what I know as well. So I really appreciate experts like you talking with me and teaching all of us. So
I'm here to help. I'm happy to help. I'm very, very passionate about this. So anything I can do, please let me know.
awesome. Awesome. All right. Well, I'll let you go. I'll let you get
Okay.
back to work.
All right. Thanks.
I hope you enjoyed this video. Feel free to leave a comment down below, like and subscribe to my channel to learn more about ADHD and other learning disorders. If you are interested in doing the mind print cognitive assessment with me, go ahead and go to my website at ADHDlifemedicalassociates.com and sign up for a consultation with me. Thanks so much. Bye-bye.